Good morning. Welcome to Queen Victoria Hospital in our lovely labor and delivery room. I'm Ariel Christman, the registered midwife here in Revelstoke, and we're going to talk today about preparing you for your delivery here. Hoping as new families in Revelstoke here and through the Selkirk Medical Clinic, you're going to find this information useful, informative, interactive, and we're going to break up the content today in small chapters to help prepare you for your delivery. In preparation for your third trimester and your upcoming delivery, there's a few things that it's important for us to talk about. First being, as your baby is getting bigger and your body is preparing for birth, I'm hoping that you're able to still identify normal periods of time when your baby is moving. And as you're getting closer to your due date, which maybe is 40 weeks, but you may give birth a little bit past that, a little bit before, your baby should still move the same times of day, even if the movements are a bit more subtle. Err on the side of caution if you are concerned. We do want you to present to the hospital and see one of us here for reassurance and assessment. Next, we're going to talk about the importance of comfort and getting as much sleep as possible in preparation. Understandably, movement is becoming more uncomfortable, walks are not becoming as long, and your sleep is going to continue to be disrupted. So doing things you can to remain relaxed, comfortable, and confident and patient in waiting for your delivery time is ideal. And other modalities outside of your office visits that can be helpful to support your comfort and optimize baby's position in your pelvis include acupuncture, acupressure, spinning babies, which is something that you can look up online that provides an idea of energy and exercise circuits that can optimize that position of baby in your pelvis. Two other things that are for consideration and to bring to your next appointment to speak to your provider about include evening primrose oil, starting at 37 weeks, as well as dates. And finally, this is an excellent time after 35 or 36 weeks to start packing your bags and prepare for your trip to the hospital. We have provided a list of resources in this package with the in-person group prenatal session that can help guide what you include. Okay, our next chapter will be cervical ripening and thinning and effacement of your cervix. At the beginning of pregnancy, you would have started with a cervical length that was anywhere between 3 and 5 centimeters long on average. As your pregnancy progresses, that cervical tissue starts to ripen and prepare for dilation and prepare for thinning moving into your third trimester. You're going to notice more Braxton-Hicks contractions or irregular tightenings that will start to work on the thinning aspect of that muscle. Secondarily, as your baby gets bigger and moves further down into your pelvis, we're going to get better head application on that cervix, which will mechanically start to do some of that thinning work along with Braxton-Hicks contractions. Braxton-Hicks contractions are different than labor contractions because they're both irregular. They don't undulate and find themselves with a peak and a trough of intensity, and they're not timeable. They are the same type of activity as a progressive labor contraction, but these are not contractions that are going to put you into labor. In Chapter 3, we are going to discuss early labor and what to expect. Early labor is the portion of time in your labor that it takes for you to start from 0 centimeters dilated to 5 centimeters dilated. And as we've discussed in the previous chapter, depending on how long your cervix was to begin this section, that will determine how long it takes you to get to 5 centimeters dilated. There will be some contraction variability in this portion of time. Sometimes contractions can feel quite regular to begin with. Sometimes your body can take some periods of a break and then continue to get closer and closer together contraction-wise as you move into active labor, which we'll review in the next segment. In early labor, there are 3 things that we're asking you to look out for. First, loose stool. 2, scant or very little bloody show, which we'll also review later in this video. And thirdly, timeable contractions that are progressively more intense and following a peak and trough pattern, as we've also reviewed in the previous chapter. Deciding when to start timing your contractions is up to you. It's a bit abstract to think about at this stage, but it will be a body instinct as to when that timing needs to happen. If you have no medical concerns, you're over 37 weeks and 0 days, and you otherwise feel well with normal baby movements, this is a perfectly reasonable time to stay at home as long as possible. This is our goal for you, as well as likely a goal you're having for yourself. As that baby is moving lower into your pelvis, depending on their position as they are head down in your pelvis, this will determine how quickly your contractions get closer and closer together and stronger. If you're starting this early labor portion of time with a thinner cervix like we've reviewed previously, 1 centimeter to 1.5 centimeters, Once that distinct thinning step has happened, you're going to notice that your labor quickly picks up in progress and quickly picks up in frequency and intensity, which will likely prompt you to come to the hospital. Most often, contraction timers or contraction apps will prompt you to come to the hospital. Otherwise, when your contractions are 5 minutes apart, lasting a solid minute from start to finish, and often contractions being in that pattern or similarly for at least an hour. We would say the same, but with a caveat of once those contractions are lasting a solid minute, that is the most meaningful piece of information for us as your providers as we think about when you should come to the hospital and stay. In Chapter 4, we're going to talk about your assessment and admission here at the hospital for your labor and your active labor. In your active labor, at some stage, you will be coming to the hospital, admitted, and then carrying the rest of your labor through with us here at our facility. Most often, we would like to keep people here and support you on your journey in unit once you're 5 to 6 centimeters dilated. Once you feel uncomfortable or you've met the timeline of contraction frequency, we've discussed it in the previous chapter. Those are both reasonable times to come in. When you first arrive at Queen Victoria Hospital, a nurse will assess you. She will do your blood pressure, have a listen to your baby, and also take your temperature and ask you a few questions about how your labor has begun. She may then do a cervical exam, but that can also be delayed by request. Or if there's another circumstance where one of us, myself as the midwife or one of the doctors, are called in to assist and support you. Things you can expect once you are here and laboring, as we will continue to support you in moving around, laboring as comfortably as possible in different positions to try and facilitate good movement of baby through your pelvis while also maintaining some level of comfort, hopefully. In an otherwise uncomplicated and normal pregnancy, you can expect for us to listen to your baby at least every 15 to 30 minutes for a minute after contractions to make sure your baby's heart rate is happy. Blood pressure will be taken once every 4 hours, and your temperature will be taken once every 4 hours until your water has broken, which after that point will be done once an hour. Of note, when you first arrive to hospital, lots of folks are bringing in birth plans or birth preferences lists. This is a great opportunity to start an informal conversation and connection point with your nurse. As these are not standardized protocols to review, please bear in mind some level of flexibility based on the nature of birth and the variability of your care team. When you arrive in labor, our main labor room, which is where I'm seated today, is likely where you're going to be giving birth to your baby. If on the off chance it's a busy day, then you may be placed in one of the other rooms down the hallway, but still on the same floor. We're hoping you feel comfortable to bring in at-home comfort measures and items to make this space your own while you're here. We do have a coffee and tea cart, along with a refrigerator where you can place food items and other things that require storage, including colostrum. While you're laboring, we're wanting position changes to be intuitive. The nurses will be quite helpful along with us as the providers when we are here and supporting you to change positions to help facilitate baby's movement through your pelvis. What we do want to drive home is that the bed that is in the main area of the laboring room here, as well as if you're placed in one of the other rooms down the hall, does not have to be the only place you're laboring on. This is a tool like anything else, and we just don't want you to feel restricted in an otherwise normal, uncomplicated delivery. Chapter 5, Transition. Transition is the period of time in your active labor when you go from 7 to 9 centimeters dilated. This is when the intensity of your contractions and frequency really bump up a whole other level. So we're going from contractions previously at 5 or 6 centimeters dilated to 3 to 5 minutes apart. We are now moving into 2 to 3 minutes apart, each contraction lasting a solid minute, if not a minute and a half, and really taking your breath away. What you also can notice during this period of time is an increase in bloody show that we've talked about earlier in this series, as well as we've described in greater detail at the end of this video. With that, you also will notice that the pressure you feel in your pelvis in between each contraction isn't likely to go away. You're going to be working harder, you're going to be peeling off layers, and movement from position to position between contractions is going to become more difficult. The hopeful portion of this area in your labor is that it doesn't last very long. For most folks, this period of time only takes about 2 hours, which in isolation feels like a long time, but you've likely already been laboring for 6 to 15 hours to this point. Transition is a relatively short period of time in your active labor, but it is the most intense. This is a period of time when you go from 7 to 9 centimeters dilated. Signs and symptoms you can note that this is happening in your labor is not only an increase in frequency and intensity of contractions to 2 minutes apart, each contraction continuously lasting 1 minute to a minute and a half long. You'll also notice an increase in bloody show as your cervix is making quick cervical change, moving towards fully dilated. If you haven't already chatted with your nurse or your provider about pain management and this is something that you're looking for, this is a great time to start that conversation. For a lot of folks, this is a point in their labor where they feel like they want to give up. They feel like they can't do it anymore and they're not sure how much longer they can continue to labor. This is totally normal. This is a very quick jump up in intensity and frequency, and thankfully is short-lived. You've done so great to this point and fully dilated and starting to prepare to meet your baby at the end stage is just around the corner. Chapter 6 is fully dilated and ready to push. Moving from transition to fully dilated continues to be really intense. You're doing a great job, and we're almost there. With the intensity of transition carrying forward, you are fast approaching your pushing stage. As you reach fully dilated, it still can take your body a half an hour to an hour and a half to engage that driving, intense urge to push. Take this break and take this time. We're hoping that with some support, your pushing stage will be mostly a self-guided process. Although there can be some select circumstances where guided pushing and coaching may be used. During this second stage, we are going to listen to your baby's heart rate more closely, more like every 5 minutes or between every contraction, as opposed to every 15 minutes in your earlier active stage. As with your active labor and different laboring positions, we want your position changes to be self-guided and intuitive. We can provide you with some suggestions and give you some feedback of where we feel like you're getting the most power in dialogue with you. Of note, the first 2/3 of your pushing stage are going to feel the most frustrating. Sometimes it's a little unclear how much progress you are making and how long the rest of your pushing stage is going to last. A sensation that lots of folks report is lots of bone-on-bone pressure, including your hips and your pelvis in between and during a contraction. As baby's head descends underneath the pubic bone and starts to crown, you're going to feel a burning ring of fire and a change in sensation from bone-on-bone pressure to a bit more soft tissue and muscle burning. This is totally normal. What we try to facilitate is a really slow delivery of baby's head through your pelvis to minimize tearing. With your second to last or even third to last contraction, as that head is coming through your perineum and starting to remain there in between contractions, is taking long, slow, deep breaths that will support you through as we finish your labor. Once your baby gets to the eyebrows, we're going to guide you to stop pushing, which is likely your last contraction, in order to protect your perineum and, like I said, minimize tearing. Your baby is now going to do a really cool thing, which is restituting. It is going to turn totally sideways, both head and body, and prepare for its final motion out of your body. With this last contraction, the rest of your baby is going to be delivered. And your baby at that stage will then be delivered and carried right to your chest. This allows the baby to fit nicely underneath your pubic bone and minimizing the opportunity for those shoulders to get stuck. As an important side note, this last stage of your delivery is an important opportunity for your partner to provide some hands-on support, often holding a leg to provide some support in between and during contractions, or hip massaging. But this is also something that's cool that we facilitate here at Queen Victoria Hospital, which is encouraging partners and dads, if they're interested, to catch the baby. What is catching the baby, might you ask? It is literally as simple as holding your hands there just as your partner is delivering your lovely bundle of joy into the world and being the first hands-on to your baby and passing that baby to your partner. Chapter 7, delivering your placenta and welcoming your baby. For this last and final chapter, we're going to review delivering your placenta, what's involved, and the early stages of caring for your new baby. After your baby is delivered onto your chest, the umbilical cord is going to remain intact for 2 to 5 minutes. At that time, we're going to ask your partner or your support person if they'd like to cut the umbilical cord, and we'll place a small plastic clamp next to your baby until their umbilical cord starts to dry. It can often take 15 to 30 minutes for your placenta to be delivered, and you're holding your baby and you'll remain in the labor bed at this time. An important discussion topic is active management of your third stage, which involves a shot of oxytocin in your left thigh to minimize blood loss as your placenta comes out. You should know that delivering your placenta is not as painful as delivering your baby, but still our final step. After your placenta has come out, be prepared for what's called a fundal massage, which is a nurse or myself or the provider that's delivering you providing some external massage over your belly to your uterus to make sure it's well contracted and minimizing blood loss after your delivery. Secondly, be prepared to answer the question, what would you like to do with your placenta? Do you want to take it home, or would you prefer that us here at the hospital manage your placenta and take care of it post-birth? Finally, your provider will examine your perineum, see if you tore, and provide you with local freezing or anesthetic and stitches if you need them. In the first hour post-delivery, you can expect that we'll take baby over to the warmer here to complete a newborn exam, a full head-to-toe assessment of baby, including a head circumference, a length, and baby's weight. This will also be a great opportunity for your partner to put on baby's first diaper and also baby's first hat. Not only is a toque important in hospital during their first day of life to keep them warm, but it also establishes appropriate Revelstoke mountain style. As a disclaimer to this video and content, if you have concerns about the health of yourself or the health of your baby during pregnancy, please don't hesitate to reach out for urgent support here at Queen Victoria Hospital, either calling 911 or presenting to hospital as you need. If you notice any of the signs and symptoms of labor we discussed in this video and you are before 37 weeks and 0 days, this is a clear indication for you to present to hospital, along with bleeding that you're unsure about, the possibility that your water may have broken, a fever, or a decrease in your baby's movement. I just wanted to take a second to describe bloody show a little further. Bloody show is a normal progressive finding as your labor is moving along. It is thick, viscous, mucousy, and blood tinged, and increases as your labor progresses closer to transition. This is in contrast to frank bleeding, which is a medical concern, where you are feeling like you are dripping liquid blood or really thin red fluid. If you have the latter, please present to hospital ASAP. Our journey doesn't stop here. Stay tuned for an upcoming video where we're going to review the first day of baby's life here in the hospital, your transition home, and breastfeeding.